so that this muscle, the pectoralis minor, should be evident immediately on the undersurface of the pectoralis major. Now I'm going to pull this out of the way because we're going to take a look at some deeper muscles. One muscle, again, a mover of the shoulder girdle, which is coming off the ribs. This is the remnant of it, would be the serratus anterior. Notice that I have the arm in a slightly abducted position so that I can get a better look at the depths of the axillary fossa, so to speak. We have the serratus anterior extending back so that it can attach to the vertebral margin of the scapula, so that the scapula is laying down like so, and the serratus anterior is coming across to insert to its inferior angle and then up along the vertebral border, so that when it pulls, it will be pulling the entire scapula forward in a protraction movement. Here is the nerve to the serratus anterior, the long thoracic that we saw before. Now, in looking down, you pull the brachial plexus and vessels out of the way, and you will be looking at the anterior surface of the scapula. And of course, residing here is the subscapularis. And we haven't dissected it all out. The fibers of this muscle will be extending forward to insert onto the humerus on the lesser tubercle. So this is the last of the sits muscles. We saw the supraspinatus, infraspinatus, teres minor. There's one muscle that makes up the sits group on the anterior surface, and this would be the subscapularis. So as we look in here, we have our brachial plexus coming down through here. Posteriorly, we're going to have the subscapularis. On the medial wall of the chest going to the scapula will be the serratus anterior. And just for orientation, if you look down here, these are fibers of the latissimus dorsi right here, and then down in here, fibers of the teres major. So these are all the muscles then of the shoulder. And now we'll go on and look at some of the muscles which are associated with the brachium or the arm. Now on the posterior side, we've already seen the radial nerve innervating the triceps muscle back here. The nerve of the anterior compartment of the arm is the musculocutaneous, so that if we pick up one of the muscles of the anterior compartment of the arm, this would be the biceps muscle. The short head of the biceps comes up and attaches to the coracoid process, the same structure that we saw the pectoralis minor attaching to. Although it appears longer, it is really the short head. The long head is disappearing here. It's going up underneath the pectoralis major, and it's going to come up to the top side of the humerus, and you can dissect that out to follow that. So in fact, this is the long head. Now if you pull the biceps muscle heads aside, you will see that there is a nerve right in here, and if you follow that back, it should lead you to the lateral cord. So that here's the lateral cord right there. There's the musculocutaneous entering the anterior compartment of the arm to innervate these muscles. The other muscles that it innervates are the coracobrachialis. This is another mover of the glenohumeral joint, comes from the coracoid process and attaches to the medial side of the humerus down here. Coracobrachialis, of course, also innervated by the musculocutaneous nerve, and in fact you can see the nerve passing right through that muscle in this specimen. The third muscle on the anterior compartment of the arm is one which is on the anterior surface of the lower portion of the humerus down here. And this meaty area right in here denotes the brachialis muscle. And this is the third and last of the muscles which are found on the anterior compartment of the arm, each of them innervated by the musculocutaneous nerve. We're now going to look at some of the vessels and nerves of the arm. And we pointed out before how the axillary nerve and the radial nerve, as they wrapped to the posterior compartment, came very close to the bone. The remainder of the muscles, as they traverse the arm, you can see that they are protected by these fleshy components of the muscles that we just studied. And so that the ulnar nerve and the median nerve are going to be coming down. They're fairly well protected in the arm, and hence there's little damage of these nerves in this region. The artery is going to change name. Back here we saw that this was the axillary artery, and here are some of the last branches of the axillary. This is the subscapular right here and the posterior humeral circumflex. And as you can see right here, here's the posterior margin of our axilla, and it's usually marked by passing the teres major muscle, in fact, so that from this point on down we change our names, and it's no longer the axillary, it becomes known as the brachial artery. And the brachial artery is also going to traverse down along with the nerves, still bundled up with the nerves in a neurovascular bundle, and there's really only one major branch that it gives off, and that is shown right here. This is called the deep brachial. The posterior compartment of the arm is going to receive its blood supply in large part from this artery. And you can see that it travels back around the mid shaft of the humerus with the radial nerve right here. Now ordinarily the brachial artery traverses on down, and it's going to cross the elbow relative to the median nerve, so that you can see that here's the biceps muscle right here. This is actually called the bicipital aponeurosis. It helps to keep everything bound down at the antecubital fossa, and as the muscle comes down, the tendon of the biceps muscle is down in here. It's a little bit deeper, and the mnemonic is TAN. That is, the placement of these important structures is tendon, then the artery, and then the nerve. And we're talking about the medial nerve right here as it crosses the elbow. Now usually you will find a single vessel coming down, and in fact in this specimen, and some of you will find a similar sort of a scenario, that ultimately the brachial artery is going to come down, and at the level of the elbow it's going to give rise to the radial artery and to the ulnar artery. And we have a very, very high bifurcation here, so that bifurcation has taken place actually just below where it gives off the deep brachial. So that this is a little bit out of the ordinary. You usually see a single vessel coming down. And last but not least, in the illustration in the book, you will see that there are numerous vessels that do come off of the brachial to go on either side of the joint. And I think that one thing to keep in mind is that whenever a vessel crosses a joint, it's going to be giving off multiple branches that usually go on either side of the joint, and these are collateral branches to help to provide the distal portion of the limb with some blood supply should the main artery become occluded, as might occur, for example, during a dislocation.